Welcome to my telehealth multimedia presentation. I'm going to be talking about the different aspects of telehealth and how they all play a key role in making everything work. So, the four telehealth perspectives are provider, patient, policy, and technology and business. The provider is healthcare professionals delivering care through these services. They're having to adapt to these services, understand that their impact virtually is going to be a little bit harder to deliver. And that being said, you need to adapt as a provider. Patients are actually ones using the services. As a patient, there are a lot of things that go into their experience with, internet and digital literacy and just expecting whether or not you're going to get quality care and receiving that. Um, Policy refers to the laws and regulations that guide telehealth, and these rules affect things like reimbursement, licensing, privacy protections, and the technology business perspective basically includes the companies that build the platforms and systems that make everything possible. And all four of these perspectives need to work together for telehealth to function well. Um, Obviously, there's a lot of key components that go into all this, and it's very important to be sound across the board to make things work in this business. So, change in one perspective impacts all. So, if policymakers were to change reimbursement policies and allow providers to get paid for visits, providers are much more likely to start offering those services, and technological improvements can also influence the patient experience. When you have platforms that are easier, more reliable, they're a lot more satisfied and more likely to continue using telehealth. And these changes can also affect business investment. If telehealth becomes more financially stable, companies are a lot more willing to invest into developing better platforms to expand telehealth. And so instead of thinking about these perspectives separately, it's better to think of telehealth as a connected system at the end of the day, right? So we're going to go ahead and move on to the next slide here. Why collaboration strengthens sustainability? So, because telehealth is interconnected, collaboration between stakeholders becomes really important. So, providers, policymakers, patients, technology developers, when they're working towards a shared goal, the healthcare system becomes a lot more stable and effective. And collaboration can also reduce fragmentation. So without coordination, healthcare systems can become confusing, inconsistent for patients. And another benefit is that collaboration helps encourage more, equitable healthcare design. When different perspectives are involved, systems are a lot more likely to consider the needs of undeserved populations, including rural communities, people who may have limited access, limited digital access, especially. And overall collaboration helps create telehealth systems that are more sustainable and accessible to everybody, versus a certain demographic of people that come to the doctors. So, telehealth has made a huge impact on healthcare delivery. So, it's already had a noticeable impact on how everything is delivered. One major benefit is expanding access to care, especially for people living in rural areas, like I was talking about, who where specialists aren't going to be close to them. It also reduces travel time and other barriers for patients. Instead of taking time off work or driving, many patients can connect with providers from home through their laptop. And it can also help improve management of chronic conditions because providers can check in with patients more frequently. However, there's a laundry list of challenges that come with this. And the biggest concern in my mind is just this digital divide, right? And not everybody has the same access to reliable internet and digital, access. A lot of people face a lot more liabilities behind the screen, and that can play a huge role in things being delayed and not going as planned, which can lead to people wanting to throw the idea of telehealth in the trash, right? um so policy as a structural foundation, like for example, licensure rules determine whether or not healthcare providers can treat patients across state lines. So more flexible policies can expand access to care. So reimbursement policies are another major factor, right? Like if insurance companies reimburse telehealth visits similarly to they do in-person visits, like providers are going to be a lot more likely to offer virtual care. Privacy regulations are also important. Healthcare systems need to ensure that patient information stays secure during virtual appointments. Sorry. Overall, policy provides the structure that allows telehealth systems to operate safely, sustainably, and keeps people optimistic that their information is being cared for, it's secured, because a lot of incidents that go on between doctors, if you are connecting over Zoom and you're trying to spill your heart out to your physician and you're like, I'm going through X, Y, and Z, a lot of people don't want all that to be broadcasted, right? And there's a lot of policies that are in play that allow the systems to operate safely, sustainably. Um, yeah. So innovation and the way AI integration has changed is out of this world. AI is beginning to support healthcare providers by helping analyze patient data, assist with clinical decision making. I mean, remote monitoring devices are also becoming more common. These tools essentially allow providers to track things like heart rate, blood pressure from a patient's home. We can also see more hybrid care models where patients combine in person visits with virtual appointments. And as healthcare continues shifting toward value based care, telehealth will likely play an important role in improving efficiency and patient outcomes, which will help telehealth grow in general, which is important. And so for the final slide, strategic recommendations for sustainable telehealth. So several strategies are important. First, reimbursement policies need to remain stable so healthcare organizations feel confident investing in these telehealth programs. Secondly, improving digital literacy can help more patients feel comfortable using these programs. Providers also need training so that they can effectively deliver care through these digital systems, because it's different than being in the flesh with somebody. To be able to get your patients to resonate with what you're saying and to feel comfortable, that's going to require like a certain level of training and organization. So finally, technology developers should focus on designing platforms that are accessible and easy to use for a wide range of patients. And if these strategies are prioritized, telehealth can and will improve and continue to improve, improving healthcare access, quality, and efficiency in the future of telehealth. And ultimately, this is my presentation. Thank you.